Next slide.
Studio Coaster, if you have any reflection, query or sharing, you may interact. Sundar Bhai is there with us. Welcome.
Let us start the session. Namaste all. Welcome to the weekly refresher session of holistic human health. So today we will understand women's health, because women's health is the foundation for healthy society. So it is very important for us to understand what we have to do so that women in our society, in our family, they stay healthy and they make our family, our society healthy. So as we all know, women are the architects of creation, playing a pivotal role in shaping individuals, families, societies, and nations with their remarkable physical and mental contributions across a myriad of fields. Women hold a distinguished and esteemed position within the society. It is imperative to safeguard their health and enhance their way of life. Ayurvedic principles suggest that the dominance of doshas and their various combinations of vata, pitta, and kapha, they induce distinct physiological transitions throughout a woman's life. These transitions define the stages she passes through, and they are known as Kanya, Gauri, Mugdha, Atirudha, Vriddha. So different stages of life dominated by different doshas and their permutations and combinations, Vata, Pitta, and Kapha. So before I go into the stages of women's life and what doshas are dominating her in that particular stage of life, we need to understand what Vata, Pitta, and Kapha is. As we all know, our body is made up of cells, tissues, organs, organ systems. So physically, we can see these things. We call them Sapta Dhatus in Ayurveda. Rasa, Rakta, Mamsa, Medo, Asti, Majja, Shukra. Dhatus, 7 dhatus are there. They are like tissues and organ systems. But we also have Vata, Pitta, Kapha, which are controlling the health of these saptadhatus, controlling the physical health and mental health, and various activities happening in the body are being controlled by Vata, Pitta, Kapha. So Vata, Pitta, Kapha, you can say we have Panchamahabhutas outside the world, and the same Panchamahabhutas are also there inside our body. Combination of these Panchamahabhutas, like Vata is made up of air and space, Pitta is made up of fire and water, Kapha is made up of earth and water. So Vata is the air part which moves and it controls the movement inside the body. Any movement, physical movement or movements which happen inside the nerves, signals carrying, being carried from one place to other part of the body, or even various fluids which are traveling through the body, food traveling through the body, or even the bowels coming out of the body, and the baby traveling from the womb to outside world. Every movement is being controlled by Vata. You can say musculoskeletal system and nervous system are all under the control of Vata. So yeah, ఆడవాళ్ళందరినీ రమ్మనండి చిరంజీవి వెళ్ళి ఆడవాళ్ళని రమ్మని చెప్పు. Okay, so Vata is the one which controls nervous system, movement, musculoskeletal system, everything is under the control of Vata. Then we have Pitta, which controls the metabolism. So each and every chemical reaction taking place inside our body. We eat food, it is being broken into small, small parts, and then energy is produced, and then tissue building happens. All the chemical reactions are under the control of Pitta. Then we have Kapha, which gives a shape to the body. Each cell is joined and working together with another cell. So all the unity among various cells and tissues and organ systems, which gives a proper shape, including the connective tissue, everything which connects one cell to another cell and gives a physical form to our body is kapha. So these vata, pitta, kapha, they play vital role in maintaining the health, and when they are in balance, we are healthy. But in various stages of women's life, there are some disturbances naturally happening inside the body, which will cause specific changes inside the body, hormonal imbalances, metabolic changes, physiological changes, which needs certain lifestyle modifications to bring the balance. Let us understand what they are. So when you classify the age of woman, so during childhood, till 10 years, we call the girl as Bala. Bala until 10 years. So general development happens during this 10 years. And during this time, kapha dosha is dominant in the body. Pitta and Vayu are very insignificant. Then from 10 to 12 years, we call the woman as Kumari. When development of secondary sexual characters happen, and then also still kapha is dominant inside the body, but slowly pitta starts dominating the body. It gains momentum. Pitta inside the body, which is responsible for hormonal changes, starts becoming more dominant. Then we have the most important stage in life, that is 12 to 16 years. It is called rajomati. That stage of woman's life is called rajomati, when the menstrual cycle starts and the woman actually is ready to even conceive also. Even if it happens, she will be able to bear a child. So her body slowly starts developing into a complete woman, and kapha and pitta are equally dominant in this particular stage. Vata is still insignificant during that particular time. Then we have the middle age. Middle age, like after 16 to 40 years, they call yuvati only. So maximum reproductive capacity is seen during this time. And then this time again, pitta is the dominant force. Kapha slowly, the domination of kapha reduces during this time. So maximum hormonal activity happens in this time, and excess pitta dominance is seen. Previously, in the Rajomati stage, there is a balance between Kapha and Pitta, but now the Pitta is completely dominant. Vata is still insignificant. Then Praudhavastha is from 40 to 50 years. It is like the premenopausal state. So Pitta again is still dominant. Slowly Vata gains dominance and Kapha becomes less significant. Then after 50, the menopausal stage comes where the vata starts dominating the body, pitta's domination comes down, and kapha is insignificant. And after 50, whatever time it is called, vruddha. So this classification is mentioned in Ayurveda, which is having a specific significance. If you see in various stages of the life, various doshas are dominating the body, and because of that various changes inside the body happen, And Ayurveda, according to the stages of these dosha dominance, prescribes specific lifestyle modifications for women. So if you look at this thing, Rajaswala Paricharya, Rutimati Paricharya, Garbhini Paricharya, Sutika Paricharya, Rajo Nivritti Paricharya, all these are various lifestyle modifications in various stages of women's life according to the dominance of various doshas inside the body. So Rajaswala Charya, when the girl first menstruates at the at the beginning of her menstrual cycle, at the immediately after menstruation, women generally were prescribed laghu ahara, food which is very easily digestible, prepared by mostly milk and ghee. So the significance of milk and ghee here is milk and ghee are pittahara, because the pitta domination starts in the Rajaswala time. Excess heat gets produced inside the body. Avoiding spicy and sour foods which will increase and aggravate pitta, and eating more and more cooling and calming and pittahara dravyas like milk and ghee and other herbs will help the Rajaswala, the woman, lady in that age, balance her pitta without having any adverse effects of pitta prakopa. So sleeping in the daytime will increase kapha, which is not good. And during that time, we should not perform strenuous activities. So even body massage, oil massage, domestic work, religious activities, sexual activities, all are not good during this Rajaswala time when the menstrual cycle is happening. So this is something which we need to understand in a scientific way. Because nowadays, when we say during the menstrual cycle, you should not do activities, you should not do religious practices, you should not do a lot of physical activity, women get offended. They are getting offended because they don't know the reason behind the activities which were prescribed and activities which were prohibited. In a scientific way, it was prescribed. But unfortunately, when the traditions and customs are being handed over to the next generation, the scientific explanation was not given. They were expected to believe everything blindly without asking any questions why I should do it. And after few generations, people started making these blind customs, and people started behaving as if a woman is untouchable during the menstrual cycle. She is not, bad omen during menstrual cycle. We should not even look at her, not touch her, not allow her to do anything. This has become a ritual type of thing in Indian households, which made women rebel against these practices, which seem to be unscientific and, in fact, inhuman. But I will give you an example of my grandfather's house, where I had three uncles and three aunties, and even my grandmother was also in menstrual period, not undergone menopause at that time when I was a child. So I used to visit my grandfather's place during holidays, and it was a huge house. It's a joint family, lot of activities. It was a village. People, my aunties used to bring water from the nearby well. They used to do everything with their own hands, either washing the clothes or making atta or making idli batter, everything with their own hands. Lots and lots of physical activity, and all four of them used to wait for their menstrual cycle time, because during that time they can happily refrain from work, stay in their house, read some nice books, food will come to their feet. People will come and play some nice Astachamba and all those things. Like so nice mahal. And they used to love that time. They used to appreciate the facilities given by others. But nowadays, because there are no joint families and the customs are being blindly followed, and if you look at the ads in the TV, they will tell you, wear a sanitary napkin, and even during that time, you will be able to do physical activity, go running, play tennis, all those things you can do, because they don't understand this concept. During the menstrual cycle, woman is losing lot of blood and lot of hormonal imbalance is happening. Pitta dominance is there inside the body, and during that time, if you ask her to do a lot of physical activity, previously women used to do a lot of physical activity. If they continue doing that physical activity, they will lose a lot of energy. Psychologically also, because of the hormonal imbalance, there is a lot of disturbance in the mind. If during that time they are allowed to do all the, if you put lot of physical strain and mental strain on their body and mind, it will be taxing on them, it will destroy their health. That is the reason why they were allowed to take rest completely during the menstrual cycle. But if you don't understand the reason behind it, and if you treat them as untouchables during the menstrual cycle, that is a bad thing which is happening. And it is because of lack of understanding of the scientific reason behind this tradition. This tradition is gone. So now, even during the menstrual cycle, women have to do a lot of work even today. So that tradition should be restored. During that time, during those days, husband and mother-in-law, they used to do all the work and they used to get some rest. Women used to get some rest, right? So because the pitta prakopa happens particularly during the menstrual cycle, it is very important for them to take pitta hara, cooling food, and avoid all the spicy and other things, and avoid a lot of physical strain which will in turn disturb the hormonal imbalance. Then there is another important part called ritumati charya. Ritumati charya, so ritumati is the woman stage of woman's life where the woman is ready to conceive. So rituals which prepare women for conception, we call them Rutimati Charya. So the best period for conception is after the stoppage of menstrual cycle till next 12 days. This time is called Rutukala. The cervix, it secretes alkaline mucus inside it, and that alkaline mucus is nutritive for spermatozoa. The sperm, when it enters the cervix, it will be nourished by the secretions of the cervix, and the cervical mucus is favoring the sperm to swim through the uterus, go through the fallopian tubules, and reach the ovum, and the fertilization happens in the proliferative phase. So this is the most important time, Rutimati Charya. So what one should do during Rutimati Charya, especially if one is trying to conceive, one tries for pregnancy. So what type of food we need to take, what type of physical activity is needed. All these things were in detail explained in Rutimati Charya. We will discuss it in a later date. There is also when newly wed couple, wife and husband, they want to prepare their bodies for the next generation. There is a special samskara called Pumstvana Kriya. This Pumstvana Kriya, what we do is like we do Bija Suddhi. So sperm and ovum are like bijas, and their bodies, women's body is kshetra. So we do bija shuddhi, we do kshetra shuddhi. We do panchakarma therapies for husband and wife, and we prepare the body so that all the toxins which got accumulated over a period of time will be removed from the body, and a healthy semen, healthy sperm gets produced, healthy ovum gets produced, a right ovulation happens, and fertilization happens in a right way, and the baby grows in a right way in mother's womb in a healthy way, and a healthy baby gets delivered in a normal way, not a cesarean operation and other things. So this preparation is called Pumsana Karma, where we prepare the man and woman for conception. So this entire process, which includes some detoxification therapies and hormonal correction therapies and rejuvenative therapies, these are prescribed by Ayurveda, and couple after they take a decision that they want to have kids, they can visit a nearest Ayurveda doctor and they can take the help of Ayurveda doctor and perform these Bija Shuddhi Prakriyas and detoxification procedures before they start preparing for the conception. So this in this what woman is supposed to do is all called Rutimati Charya. Then once the woman conceives, the baby is growing inside the body of woman. Then what we do is called Garbhini Paricharya. So care to be taken during her pregnancy with ahara and vihara. What food is important, what physical activity, what mental activity, what kind of pranayam, what kind of breathing exercises, what kind of music, what kind of colors, each and everything is prescribed in detail in Ayurveda. So, so prenatal period or antenatal period, complication without any kind of complication, smooth experience, safe delivery, healthy perpurium. So generally in our textbooks, they say that the first delivery of a woman, the pains may range from 6 hours to 48 hours. The pregnant lady during the labor, it might get delayed up to 48 hours also. If it goes beyond 48 hours and if the woman is becoming weak, then they will go for cesarean section, C-section. So in Ayurveda, this Garbhani Paricharya, right from the conception till the labor, everything will happen in a natural way without any difficulty, and it is so nicely described to make the entire experience a memorable experience for the mother, not a painful experience. So in my case, Suryakamji, you have some question, you can switch on the mic and ask.
या नमस्ते भैया नमस्ते
Namaste.
भैया मेरा ये पर्सनल क्वेश्चन नहीं है मेरा एक स्टूडेंट है एक्चुअली सी यूज्ड टू स्टे इन हैदराबाद
Okay.
सी मैरिड आई थिंक सम बिफोर 2-3 years back.
Okay.
So I am the guide of her in during PhD also. She is doing PhD also.
Okay.
But what is the issue with her is almost I hope 3 times whenever she become pregnant, but
Abortion happens.
abortion happened almost I hope 3 times.
Okay.
And I think she told she was under complete medical care,
Okay.
allopathy earlier, and even last time, just the recent one,
Yes.
she has taken the not allopathy, that Ayurvedic treatment, but in Hyderabad only. But I don't know what all the treatment she took.
Okay.
But it happened almost, she was telling, each time there were twins.
Okay.
But this last time there was no twin, single baby was there. But it happened continuously. She was so nervous. She
Okay.
could not do well in her PhD work also. And mentally also she has become weak, and even physically. Anyway, the outer look is okay, but I think mentally she is so weak.
Yes.
Is there any permanent solution in Ayurveda? That is my question, Bhaiya.
Yes.
Anyway,
Yes.
I will give her your contact to her. She will personally talk to you.
Yes. So
And
we
if
have
possible,
this, really useful therapies for women who have these habitual, regular abortions. Various reasons are there for these abortions. So we need to do the Bija Shuddhi anyway, but to prevent the abortions, to help the baby grow without any problem, Even in the fetal stage only, you need to strengthen the baby's life. And there are some really wonderful therapies and medicines and activities which the woman needs to start long before the conception. Not just the woman, also her husband. So if both of them will undergo panchakarma therapies and then they conceive, then the chances of getting aborted will be almost minimized. So yes, we can definitely help her through Ayurveda.
Yeah. Thank you, Bhaiya. Anyway, I will give your contact details. I think she
Mhm.
might be contacting you, Bhaiya. So
Okay,
please guide us.
sure, sure.
Okay. Thank you,
Sure.
Bhaiya. Thank you.
So when coming to my own experience, so my wife, uh, when she conceived, we have followed this Masanumasika Patya monthly dietary regimen, which includes mostly milk and milk products and cereals and green leafy vegetables, nuts, spices, jaggery, all sattvic ahara, and also some very nice music prescribed. In each month, there is a specific set of music which we need to listen, and also some exercises, breathing exercises, pranayamas, everything we have practiced. It's not like only she practiced. So whatever she needed to practice, I have practiced, and both of us did all those things. And her delivery date was March 25th. And on 24th of March also, we were having a nice night walk at 10 p.m. And then we were wondering, tomorrow is the delivery date. Till now, nothing happened. What will happen, like that? So she slept off that day, and early in the morning, around 2:30, she woke me up and she told me that she is feeling like going to motion again and again. Then immediately my mother told me, no, no, this is, I think the pains have started. Let us go. Then my wife told, no, no, let us wait till it becomes, no, after sunrise we can go. But my mother insisted that we should all go. Then we went to the hospital. By the time we reached hospital, it was around 4:45 or 5. And in Ayurveda, they say there is a special Trifladi Kashaya Vasti just before the labor, which she needs to take, and we gave that Vasti. And after that, after the Vasti, it is prescribed that the woman walks while she's having labor pains. So the nurses in the hospital, they were forcing her to sleep on the table, and they told her, "A doctor will scold you. She will be coming any time now. You have to lie down on the table." But we told her, we both are doctors, no problem. We will speak with the doctor. And we were walking till 5:45. She was walking, and 5:45 doctor came, and nurses have complained that this lady is walking, and doctor said it's very good to walk before delivery. The gravity will help the baby come outside easily. 5:49 she was on the bed, on the operation table, and I was with her inside the operation theater, and 5:51 delivery happened. She was there only for 2 minutes, and she was asking me, over, that's all, so easy. So, if we follow the Garbhani Paricharya prescribed in Ayurveda properly, this whole experience will be so nice and memorable for the mother, for the husband, for everyone around, and and for the baby also. This whole thing is like so painless, means less pressure on the baby, and the baby will be very healthy. So, the same thing happened when the second delivery also. Same thing happened with my sister also. So all of them, many people from my patients, they have practiced this Garbhani Paricharya, these breathing techniques and asanas and all those things. And we have a special mechanism, a special way of breathing we need to follow while the labor happens. Because the contractions, they happen rigorously sometimes, slowly sometimes, no contraction sometimes, and it happens in a rhythmatic pattern. And during that time, if the breathing part is taken care of, then the entire process will be very, very comfortable and easy for the mother, and less taxing on the baby. So this is so nicely prescribed in Ayurveda. So it is our responsibility to help each and every mother with the help of Ayurveda. Okay. So there are so many things like general code of conduct, like avoiding negative emotions, good conduct, worship, wearing clean and light colored clothes, comfortable clothing. And of course, there are some things which happen like nausea and vomiting during the first trimester. Then we give milk medicated with Jatamamsi, we give Madhipal Rasayana, we give Mayurchandrika Basma, and hyperacidity we give amlaki kalka with honey. So many things which simple gruha vaidya, simple home remedies which will help the mother stay comfortable during her all the 3 trimesters. So this entire concept of garbhani paricharya nowadays, it is also called garbha samskara. So a special regimen for women during the 9 months, which will help her have a comfortable normal delivery without any complications, and she will give birth to a physically and mentally strong baby. So that is, even we are planning to conduct antenatal workshops for 3 days for pregnant women, teaching all these things which we have learned in Ayurveda, which we have already put in practice with, in our lives, and also many patients were got helped by this Garbhani Paricharya. So nicely it was written, and it is our responsibility to put it into practice. Then we have Sutika Paricharya. So regimen after delivery. So immediately after delivery, we need to understand that all the traditions which are there, they are so scientifically designed. So it is mainly due to, or to overcome loss of nourishment, to prevent the mother from other diseases, to help her in proper lactation. So nice massage with bala taila, any oil, good medicated oils. And in Andhra Pradesh and Telangana, they put these leaves of nirgundi. We call it as vavili, nirgundi or sindhuvara leaves. Those leaves will be kept in the water to boil, and that water will be used to take bath, which will reduce the excess vata inside the body of a sutika. Wrapping the cloth on abdomen and waist area, vaginal douching done with decoctions of Lodra, Arjuna, Daru Haridra to prevent infections. Intake of Vatahara Kashayas like the Samola Kashaya, milk prepared with Vidari Gandhadi Dravyas to promote, to relieve the pain and promote lactation. The traditional practices of, in Andhra Pradesh and Telangana, there is the practice of giving a special preparation with so many spices and other things. So, like there are also preparations like Balim Takada, all those things for the mother to regain the normal hormonal balance. Uterus will come back to its normal size and shape. Lactation will happen in a proper way. No infections will happen. All these things will be taken care during the Sutika Paricharya. Again, coming to the traditions, I would like to narrate my own experience. So, I told you just within 2 minutes, she had the delivery on the table. And because we know the doctors, they have not taken a single rupee from us. And evening, they have discharged us. So my wife got discharged. We came back home on the same day. And in Vishakhapatnam, in my house, my parents have arranged a special room for her, which is not our house. We have a house. We had a house in first floor. In the ground floor, my clinic was there. Adjacent to the clinic, there is a unused room like a store room. They have cleaned the room and kept a cot there, and they've arranged the stay for her for the next 11 days. So I asked my parents, what is this? They said, this is the ritual. You have to follow it. So she should not enter our house. It is what is being practiced so many years in our family. So my wife got so much irritated. And second time when she got pregnant, she told me, even if I have a normal delivery, I will stay in the hospital for the 11 days. Only after 11 days, I will come back to house. That is what she told me. Then I spoke with my parents and asked them why is this? She should be allowed to stay in her own bedroom. Why this discrimination? They said, no, this is the ritual. This is the tradition. We can't, if you don't want to do, you take another house and keep your wife in your house. So that is what they told me. So what should I do? Should I please my wife or please my parents? What is the solution? So then I took my Shushrut Samhita and I read some chapters from Shushrut Samhita. There is the Sutika Paricharya. So in that, really during those days, they used to have a separate room, which is different from the regular house. Because they used to have so many deliveries, all the mothers, they used to have a separate room, which is prepared according to the Shastra, made suitable for the residence of mother and the baby. They used to put a lot of dhupas and lepas and shuddhi prakriyas and homas and havanas and hang so many disinfective leaves like nimba and arka and so many other things. And they used to prepare the entire house in such a way, that room in such a way, that there will be no infection either to the mother or to the baby. So they used to take a lot of care, and all these things are written in Shushrut Samhita. Okay, so this Puriti Maila, which we call like the thing, the 11 days where you should not touch the baby or touch the mother. So this is something to protect her, because she loses a lot of blood and her immunity levels become very less. Just like a person who underwent surgery, after surgery, post surgery, they keep the person in a aseptic condition, completely devoid of infections till the immunity becomes strong. Similarly, mother also needs an aseptic condition, place where she can comfortably live, and she should not be visited by everyone. And the baby is also very comfortably placed inside the mother's womb for 9 months, and suddenly the baby gets exposed to the environment, and all the germs and other things will attack the baby till the baby develops infection, immunity. These two entities, both the mother and the baby, they need protection, and for that protection, these special rituals are being made. Even if the father wants to visit the baby or the mother, he needs to undergo a lot of shuddhi prakriyas, and once the purification process happens, then he can enter the room where the mother and baby are staying. So that was our ritual. But nowadays, what is happening? So in the hospital itself, all the relatives will come, kiss the baby, and they go back to home and take bath, as if they are getting some infection from the baby or the mother. So you are not supposed to go near them. That is the reason why this 11 days Mila was told as a precaution. It's a scientific way of protecting the baby and mother. It's not something to alienate the mother and baby. So once I've explained all these things to my parents got convinced, and they said, okay, we will arrange the room accordingly. But one rule, you should take out the mattress and put the wooden thing. And I said, okay, whatever. If you allow her to the bedroom, that is okay. So whatever it was written in the book, we tried to do as much as possible. So once we understand the scientific reason behind our rituals, then these rituals will go from one generation to next generation. If you don't tell the next generation the reason behind the rituals, then the rituals will be lost. They'll rebel against the rituals, and they will stop doing it. Even if they are good, they will not do it. So it's very important for us to understand and for us to take these rituals next to the next generation in a scientific way. So Sutika Paricharya, yes, Arunachalam ji.
Good evening, doctor.
Good evening.
So I try to contact you, but unfortunately, unable to contact you.
Okay.
Yes, my wife's feet, some scratches are there.
Okay.
I went to the doctor. She told there is no medicine for the English. $0, some medicine for the better relief. Doctor gave that medicine.
Okay.
Ayurvedic, some cream or legume is there to control this. If you want, I will share the picture in WhatsApp. Your number.
So yes, you can make me speak with your wife not after the session. Today I'll be very busy because we have a workshop from tomorrow morning.
Send the mail.
Yeah, you can send me a WhatsApp message.
Okay.
Then I'll tell you when to contact me. Okay.
Okay, right. Is it
Okay.
any solution for this one?
Yes,
Even
definitely there is a solution. Yes, yes.
Told salt and turmeric powder dipped in hot water, some relief will get.
Yes. I will tell you what to do once I speak with your wife. Okay.
Okay, thank you.
Yeah. Okay. So Sutika Paricharya is very important for preserving the health of the mother, promoting the lactation, and also the child's health is completely dependent upon the health of mother. So if mother is strong and healthy, then child also will become strong and healthy. He will get all the immune strength from mother's milk. If mother is strong and immune to all diseases, the child will become very strong, both physically and mentally. So it's very important for us to understand this Utka Paricharya and follow it meticulously. Then we have this Rutu Bandha Paricharya. So once the menopause happens, after menopause, we see so many problems affecting women. Suddenly, the hormonal imbalance goes to a peak stage. Hot flashes, weakness in joints and muscles and bones, and some psychological disturbance, mood swings. All these things happen after menopause. So it's very important for us to understand what a woman needs to do once she attains menopause, so that she will not undergo any kind of harmful changes and adverse reactions of menopause. So, and another important thing I would like to share at this particular thing is, unfortunately, many women nowadays are not reaching the menopause stage at all. Why? Because their uteruses are being forcibly removed from their body. Hysterectomy is being performed, even for a small cause like a small fibroid in the uterus, overbleeding for a few months. And because they don't know how to solve this problem, the easiest solution is to remove the uterus, as if the uterus is a vestigial organ after the childbirth, as if it is useless. But unfortunately, that is not true. Uterus is an essential, important part of the body, which is a part of endocrine system. So when you remove the uterus from the body, lots and lots of hormonal disturbances happen inside the body, and so many health problems will start attacking the woman after you remove the uterus. Majority of the people who come to our hospital with knee joint pain, disc problems, neck pain, and other degenerative disorders inside the body, women, 90% of them are people who underwent hysterectomy. They are the people, they are the women who get affected, maximum effect, disturbance happens in women who get their uteruses removed. So it's very important for us to understand that we have to avoid hysterectomy as much as possible. Unless it is a must, unless there is some really serious trouble, we should not remove the uterus. But simple problems like uterine fibroids, even we have treated women with fibroids size of tennis ball. Tennis ball size fibroid also got dissolved with simple Ayurvedic treatments and medicines without any surgery. Severe uterine bleeding gets controlled and other problems get controlled. And without undergoing surgery, just by undergoing some panchakarma therapies and some simple medicines and lifestyle changes, forever they can be healthy. And once they correct their health using these therapies, the rest of the lifetime will be very comfortable for them. So if someone in your family, in your friend circle, or anyone who you know is trying to undergo hysterectomy, tell them not to go for hysterectomy and tell them to meet a nearby Ayurveda doctor who will be able to help her come out of her current problem and stay healthy after the menopause time, or even before. Like nowadays, at the age of 40, 30, 25 also, women are undergoing hysterectomy. there was a show called Satyameva Jayate in television, hosted by Amir Khan, maybe some 10 years back. And in Telangana, so at that time, this Arogyasri was newly introduced. And he took the camera to one village in Telangana, and all the women in the village came to the meeting, and Satyameva Jayate crew members, they went there, and they were asking the village women, how many of you underwent hysterectomy? And all the entire village women, they have lifted their hands saying that they underwent hysterectomy. So it was a big scam happening in those days because it was covered in Arogyasri. Hospitals, they were going to interior villages and conducting medical camps, and unnecessarily they were conducting hysterectomies. So it was unfortunate that so many women lost their uteruses due to the greed of these hospitals. And immediately then, after the scam got exposed, they have removed hysterectomy from the list of surgeries allowed in Arogyasri. So, but still, even today, if you have insurance, if you are ready, if you are willing, immediately doctors are removing the uterus. It's very unfortunate. So it is very important for us to educate women and tell them the perils of hysterectomy, and ask them to try Ayurvedic therapy, and see if they can solve their problems with simple Ayurvedic treatments. Like there are so many things, like Shatavari is a well-known rejuvenator. Vacha and Jatamamsi can be taken after meals twice to relax the mind and strengthen the mind and nervous system. Erandamula, Punarava, Gokshura can be taken to rejuvenate each and every cell of the body, reduce pains, strengthen the musculoskeletal system. Do a lot of pranayama, specifically Kumbhaka, more and more practice of Kumbhaka during the menopause stage, and then applying oil to the body every day, each and every day, applying oil to the body before taking bath, doing nasya, 2 drops of til taila or some medicated oil every day before bath. All these things will help a woman, cross this stage of menopause smoothly. And this time is very important time, because the woman at that period of time will be gaining lot of experience during her entire life, and her experience is very valuable for the next generation. And if that woman is not healthy, if she is suffering with so many diseases, how will be she able to guide the next generation? So if she is healthy, if she is happy, if she is sound physically and mentally, strong physically and mentally, she will be able to guide the entire family. That is how our grandmothers used to do. They used to be like family physicians for every family. They used to guard the family. They used to put a Rakshana Chakra around the family, and they used to see that no one goes to a hospital unnecessarily. So it's our duty to help women stay healthy in this particular stage of life, so that they will be a beacon of light for the next generation and pass on their experience to the next generation, their wisdom, their knowledge to the next generation. So it is our good fortune that in our Indian system, Indian knowledge, there is an ocean of knowledge hidden in the Samskrita Vagmaya, particularly Ayurveda, which speaks about each and every aspect of human life. The very concept called Swastha Vritta, preserving the health of a healthy person, how to stay healthy always, how to avoid any kind of visits to doctors, how to not outsource your health to doctors, how to keep your health in your hands. This is so nicely explained in Ayurveda. So it is our responsibility to learn and understand this knowledge and put it into practice, so that we all will stay healthy in all stages of our life. So that's all for today. And if you have any questions, I can take some questions, and then I will close it by 8:30 sharp today, because I have my participants waiting for orientation program for tomorrow's workshop. We have a workshop from tomorrow. Yes, Surikantji.
Yeah, Doctor, namaste.
Namaste.
That's, I have one question related to not this present, what discussion went.
Yeah.
That's my friend, he is suffering from leukoderma. That's
Okay.
the skin is becoming white.
Yes.
Yeah, is there any permanent solution according to you?
Leukoderma is a autoimmune disorder where the immune cells attack the skin where the melanin production happens. So, and those parts of the skin where the white blood cells are attacking, the melanin will not get produced and skin turns white. Okay. So, because it is an autoimmune disorder, we need to correct the immune system, and we need to see that immune system will not attack the skin anymore. And once the immune system gets corrected, we need to see that the melanin production happens in that particular part to restore the normal skin color. So it is a combination of panchakarma, some special therapies like leech therapy, and also because it is an autoimmune disorder where the mind seriously gets disturbed, we need to practice a lot of pranayama, meditation, food modifications. All these things will help to restore the color of the skin normally. But if the leukoderma appeared long back, 10 years old, 20 years old, it will take a lot of time to solve. Recent origin leukoderma will easily get cured. That we have seen in our practice. And kids who get leukoderma, they'll get cured within 1-2 months only. Elderly people whose problem originated recently, they will get cured fast.
Yeah, that's he is suffering from 15 years, Bhaiya.
15 years, then it will take a longer time to solve it also.
Okay, that's any as you conducting workshop, Bhaiya. That
Yes.
is there any treatment under your common workshops which you are conducting? He is
These
ready to
workshops
come.
are health workshops where we
Okay.
teach them how to stay healthy.
It is not specific with any diseases.
No, these workshops are not disease-specific workshops.
Okay, okay.
So they can come and get admitted in our hospital and get treated.
That for facility is there.
Yes, we have a 40-bedded hospital.
Yeah, nice, Bhaiya. And parallelly, I think workshop will also help them.
Definitely help them. Every month the workshop will happen. So whenever they attend, they can also attend the workshop.
Yeah, Bhaiya, he does not understand Telugu. He can understand Hindi, English,
No
Kannada.
problem. We will, Kannada, my wife speaks Kannada, Dr. Kavita.
Okay, nice.
Okay.
Then I think it is good for him.
Yes.
He is interested to join.
Yes.
So I will suggest Bhaiya then.
Yeah. Okay. You please suggest.
Yeah, thank you, Bhaiya. Thank you very much.
Namaste. Dr. Ganesh ji, you have a question? Ganesh Chaturvedi ji.
Namaste.
Namaste, sir.
Sir, namaste. Actually, I have another question that you mentioned earlier a lot of times, but my wife certainly has got that sugar problem. Okay. Suddenly, it was not known. But she was having certain problem during say last 3-4 months, but we could not go through all that things. We are thinking that she was something weak, etc. But suddenly now, after that, we got the she has that. Another thing, she has also the cholesterol. Okay, now, sir, anything that medication can you see, or anything that precautionary measure, food, etc.
See, the thing is, diabetes is a metabolic disorder, and we also call it a lifestyle disorder.
Lifestyle disorder.
Very important for her to correct her lifestyle, do some physical activity, perform pranayama and meditation regularly, and correct food. Then the medicine's role is very little. It will help in restoring the balance in the pancreas. And if there is any insulin resistance in the cells, that can be corrected with medicines. And once the lifestyle gets corrected, she will not have to use medicines for diabetes forever in her life. Maybe 6 months she can use, and after that she can stop. But she has to maintain a good lifestyle throughout her life.
Sir, that lifestyle means that regarding that food habit, etc.
See, eating in time, sleeping in time, waking up in time, doing physical activity, exposing her body to sunlight, avoiding mental stress, doing pranayama, doing meditation, doing yoga, all these things, and eating good food, eating in the right time. Yes.
Okay. For the cholesterol, sir?
Yes. See, hyperlipidemia or high cholesterol.
High
Also
cholesterol
a metabolic disorder. Is also a lifestyle disorder.
Oh,
when lifestyle gets corrected, all these problems will get corrected. Yeah.
Acha.
So you don't have to use medicine forever in your life.
हाँ हाँ
Medicine
हाँ
will help you for few months, and meanwhile you should help your body, and the body should take over. It should heal itself.
correct.
Yeah.
Okay. Okay. Thank you, sir. Thank you.
Thank you so much.
हाँ.
We can take one more question. Otherwise, we can close our session today.
Thank you, Sundar Bhai. It's really a very enriching day, and certainly our sisters, Didi Log may get benefited from the session.
Yes.
We certainly like to have more healthy discussion, more harmonious discussion, more and more. We will like to see you again next Friday, same time. Till then.